Dr. Flick. So as my mum always likes to clarify with all of her friends, I'm not a real doctor. And she's technically kind of right, because I'm actually a placebo doctor. And tonight I'm going to be telling you all about my magical placebos for pain treatments. That's right, using the deceptive tricks of magicians, I invented fake treatments for pain that trick people into believing the fake treatment is real. We call these placebos. And placebos are actually really important for us to be able to develop more effective treatments for pain. And we all want better pain relief, right?
Yes.
Well, maybe not all the time. In fact, one of the reasons I became a pain scientist is because I love pain, which might sound kind of freaky. But really, it's because pain is just so interesting. So, in the pain research world, we use a pain scale to measure people's pain, where 0 is no pain at all, and 10 is the worst pain you could possibly imagine. But I reckon sometimes pain can go beyond 10 on the scale. For example, has anyone here ever stepped on a piece of Lego? Oh my god, why the fuck does that hurt so much? Now I'm going to re-traumatise you all by getting you to imagine 2 different scenarios in which you step on a piece of Lego. In the first scenario, you're at a party, having a great time, laughing and dancing away with your friends, enjoying your goon sack, and then you step on a piece of Lego. Yep, it hurts, and you notice it, but you only notice it for a second, and then you continue to have fun and party on. Now in the second scenario, you're at home, you're alone, you're in a terrible mood because you're hungover and you lost your goon sack last night. You're already on the verge of tears, and then you step on a piece of Lego. Oh my god, it fucking hurts so much! So despite the same amount of Lego-induced stimulation, the experience of pain is completely different. And this is because our thoughts and feelings can powerfully influence the experience of pain. And amazingly, our thoughts and feelings can also powerfully influence how well a treatment works for our pain. This is called the placebo effect. And weirdly, I think a magician defined it best. He said, the placebo effect is where something fake becomes something real because of your perception of it. It's your belief that makes it real. So, for example, even when you take a placebo pill which has no active pharmacological ingredient, it can still improve your pain. And what's really crazy is that things like the colour, size, shape, branding and price of the pill can all have different effects on your pain. So, for example, a blue pill is more effective than a white pill, and a capsule is more effective than a round tablet. Isn't that weird? Well, it's actually because you're all just appallingly superficial, and even trivial aspects like the freaking colour can change your pain. So this important research has allowed us to develop maximum strength placebo pills. But unfortunately, these don't seem to be strong enough to cure pain. So us pain researchers have turned our attention to more complex interactive treatments for pain, such as exercises, manual therapies, needling therapies, and even surgeries. And these types of treatments have even bigger placebo effects. So for example, a placebo pill is less effective than a placebo injection, which is less effective than placebo surgery. Yes, researchers have actually done placebo surgeries where they give a patient a general anaesthetic, cut them open, and then just stitch them right back up without performing the procedure. Sneaky buggers. And let me tell you, the placebo vasectomy trials did not go down very well. So what this tells us though, is that as treatments become more complex and invasive, they become more credible to the patient, which essentially means the patient is more likely to believe that the treatment's going to work for them, and this is what makes the placebo effect bigger. So this is how our thoughts and feelings can really influence how well a treatment works for us, which sounds cool, but the placebo effect is actually a real pain in my ass because it makes it really difficult to figure out if pain treatments actually work or if they're just creating this placebo effect. So one way we try to figure out if pain treatments actually work is through placebo-controlled randomised clinical trials, which I prefer to call trick or treatment. So this is where we get a group of patients with pain and we randomly split them into two groups. One group gets the real treatment and the other group gets the fake placebo treatment, which simulates the real treatment. And the goal of this is to have patients in both groups not knowing whether they received the real treatment or the fake placebo treatment. And we call this blinding. And blinding is really important because what it does is it equalises everything between the two groups of patients, including critically their thoughts and feelings about the treatment. So this allows us to cancel out those pesky placebo effects. Now, obviously in drug trials, blinding is piss easy. We can just make identical looking placebo pills like the classic sugar pill and no one can tell the difference. But what about these more complex treatments that I mentioned before, like exercises and manual therapies? How do we simulate these treatments without the patient knowing that it's fake? Well, I had no bloody idea. So I decided to ask the ultimate experts in deception. Magicians. So magicians have actually been experimenting with humans for centuries without the tiresome constraints of human ethics. And this has allowed them to really nail how to make us feel like complete idiots. So I realised I wanted to make people feel like complete idiots too. So with the help of magicians, I invented a fake placebo treatment for pain. And as I mentioned before, if you want a really good, strong placebo, you get an invasive treatment. Plus, who doesn't love a good poking, right? That's why I decided to create a placebo for a very pokey treatment called dry needling. So dry needling is basically where we insert needles into muscles to treat pain. And I set out to blind not only the patient, but also the therapist delivering the dry needling. Suddenly realising how unsafe this was. Anyway, anyone want to sign up for my research? So using lots of different magic tricks, we created a placebo for dry needling, and one of the most important types of trick that we used was sensory illusions. So this is where the perception of something doesn't match the physical reality, like a spoon bending illusion. Here's an example of a very famous visual illusion that you've probably all seen before. It's the dress illusion, where normal people see white and gold, but people with an embarrassing neurological disorder see blue and black. Just kidding, around half of people see blue and black, so you're not that special. And here's another illusion for you. What do you see here? This is just a loving father kissing his baby, you filthy animals. But what these illusions show us is just how easy it is to trick your superficial brains. You look especially easy. So using the principles of these illusions, we created a placebo needle. As you can see here, it's pretty pointless. So the trick to these needles were they looked externally identical to the real needles, but as you can see in the placebo version, the needle was shortened. So it didn't even touch the patient's skin, but it still gave the visual illusion of needle insertion. And for therapist blinding, we had this special resistive foam inside the needle to give the therapist the sensory illusion of piercing through the patient's skin through their fingers. And we used all sorts of other classic magic tricks in our protocol as well, like the classic misdirection that magicians often use as a form of distraction. So we got our therapists to ask the patients really deep and meaningful questions during the procedure as well. And using all of these tricks and more, my placebo for dry needling was actually the first in the entire world to successfully blind simultaneously the patients and the therapist. Humble brag. So what we saw was something fake became something real because of their perception of it. So hopefully now we can use my magical placebos for pain treatments to control for this profound influence that our thoughts and feelings have on the pain experience by tricking all you superficial idiots into believing fake treatments are real. And that allows me to develop better treatments for your pain, so you're welcome. And now I'm going to demonstrate everything I learned from the magicians and disappear.